About 1 in 9 men will receive a prostate cancer diagnosis during his lifetime. Prostate cancer is second only to skin cancer as the most common cancer affecting males. There are many successful treatments, and some men don't need treatment at all. Men over the age of 55 are more prone to the disease. Your chances of developing prostate cancer increase as you age. In fact, 60% of prostate cancers occur in men over the age of 65. This awareness video contains information about types, symptoms, diagnosis, stages and treatment of prostate cancer. Prostate cancer develops in the prostate, a small walnut-shaped gland that's part of a man's reproductive system. The prostate gland sits below a man's bladder in front of the rectum. The prostate gland makes fluid that mixes with semen during ejaculation. Almost all prostate cancers are malignant tumors called adenocarcinomas. This type of cancer starts in the cells of glands that make secretions. Rarely, other types of cancer develop in the prostate. These include small cell carcinomas, transitional cell carcinomas, neuroendocrine tumors, sarcomas. Early-stage prostate cancer rarely causes symptoms. These problems may occur as the disease progresses. Frequent, sometimes urgent, need to urinate, especially at night. Weak urine flow or flow that starts and stops. Painful urination. Fecal incontinence. Painful ejaculation and erectile dysfunction. Blood in semen or urine. Lower back pain, hip pain and chest pain. Leg or feet numbness. It should be kept in mind that not all growths in the prostate are cancerous, and not all prostate problems indicate cancer. Other conditions that cause similar prostate cancer symptoms include benign prostatic hyperplasia, which almost every man will develop at some point, and prostatitis, which is the inflammation and swelling of the prostate gland. Screenings are the most effective way to catch prostate cancer early. If you are at average cancer risk, you'll probably have your first prostate screening at age 55. Screening tests for prostate cancer include digital rectal exam. Your provider inserts a gloved, lubricated finger into the rectum and feels the prostate gland, which sits in front of the rectum. Bumps or hard areas could indicate cancer. Prostate-specific antigen blood test. The prostate gland makes a protein called protein-specific antigen. Elevated prostate-specific antigen levels may indicate cancer. Levels also rise if you have benign prostatic hyperplasia or prostatitis. Biopsy. A needle biopsy to sample tissue for cancer cells is the only sure way to diagnose prostate cancer. During an MRI-guided prostate biopsy, magnetic resonance imaging technology provides detailed images of the prostate. The Gleason score and grade groups are used to stage prostate cancer based on its projected aggressiveness. The Gleason score is used to place you into a grade group ranging from 1 to 5. A Gleason score of 6 puts you in grade group 1, which is slow-growing cancer that might not require treatment. A score of 9 or higher puts you in grade group 5, which is aggressive, faster-growing cancer that requires immediate treatment. Some people never need treatment because the cancer grows slowly and doesn't spread. With treatment, the prostate cancer is highly curable. Treatment options include active surveillance. With this approach, you get screenings, scans and biopsies every 1 to 3 years to monitor cancer growth. Active surveillance works best if the cancer is only in the prostate, slow-growing and not causing symptoms. Watchful waiting. Watchful waiting is often used in older or frailer patients. Similar to active surveillance, this approach does not involve definitive treatment at diagnosis. However, the testing is much less frequent, and focuses on symptom management. Brachytherapy, a form of internal radiation therapy. Brachytherapy involves placing radioactive seeds within the prostate. This approach helps preserve surrounding healthy tissue. External beam radiation therapy. With external beam radiation therapy, a machine delivers strong X-ray beams directly to the tumor. Intensity-modulated radiation therapy is a form of external radiation therapy that delivers powerful doses of radiation to the disease site. Systemic therapies. Systemic therapies are recommended if cancer has spread outside of the prostate gland. These therapies include chemotherapy, androgen deprivation hormone therapy, and immunotherapy. Focal therapy. Focal therapy is a newer form of treatment focusing on treating only the area of the prostate affected by cancer. Focal therapy options include high-intensity focused ultrasound, cryotherapy, laser ablation, and photodynamic therapy. Prostatectomy. This surgical procedure removes the diseased prostate gland. Surgeons can perform laparoscopic prostatectomy and robotic radical prostatectomy through small abdominal incisions. These procedures are less invasive than an open radical prostatectomy, which requires a larger abdominal incision, although both are effective in cancer removal. The potential side effects of prostate cancer treatment include urinary incontinence, erectile dysfunction, and infertility.